Hey, Dental Nachos crew, special guest here in Philadelphia, amazing nacho dentist, Dr. Josh Day. Josh, you're here in Philadelphia hanging out.
Yep.
Tell us a little bit about, you're on Dental Nachos. You posted some stuff about food the other day. Tell us a little bit about that.
That's one of the things I really enjoy. I've been in dentistry for about 13 years. And as I've progressed, I've gotten more into implant and prosthetic dentistry.
Cool.
That's really my passion. One of the biggest challenges that I feel like we face a lot of the time with these prosthetic patients is they don't know, what their dietary restrictions
Right.
are, what I can eat, what I can't eat. How can I prepare it? There's so much more that people can eat than they're aware of. And what I'd like to do eventually is to basically start up some kind of webcast or
cool.
app or book that actually can kind of pull together for patients, what kind of things they can eat, almost make it like a Good Eats kind of format. Cool. If you ever watched Food Network, Good Eats, it's not,
I love that.
That's not an endorsement.
You say what dental patients, and I think, patients sometimes are so people eat granola, which is like a tiny bag of rocks. And they say, I like granola. I said, you wouldn't just keep punching this wall against it over and over again. So people have to understand that actually this tremendous dentist from Philadelphia, Dr. Leonard Abrams, perioprosthesis, sadly he's not alive right now, but he would say food is a weapon. Because it can be, you put temporaries in and people go, I'm not going to eat something sticky. I go, what happened? They ate a Jolly Rancher. I go, what happened? And we did that. So tell us a little bit about, when did you graduate from dental school?
I graduated from University of Minnesota in 2010. So I've been practicing about 13 years now.
Awesome. What is something, I always ask this, something dental school doesn't prepare you for? It could be patient management, business management, something that you wish they told you in dental school that would make your life less stressful now.
Most definitely business management, and I don't usually, I see posts out there talking about, oh, they should teach implants, they should teach this. And I'm starting to see that University of Minnesota is starting to get into teaching more the basics, the foundational knowledge. Yeah. And really that's something to think about as far as what dental schools are providing is they're providing foundational knowledge. Some students come out, they think, oh, I should be able to do everything. But that's not typically the case. Honestly, I think business management would be a big thing that they really should push a little bit more, because I know a lot of times you get these, PPOs that come in and promote themselves and
dental school, they have to have be called out to some degree.
Yep.
They take money from spoiled guac PPOs.
Yep.
They take money from DSOs. I work with DSOs these are our newest colleagues. Their brain is not formed to make these decisions. I will explain. I have a 4-year-old. I know eating Doritos is not healthy for me. I know if I eat Doritos, it's on my cheat day. My 4-year-old,
not even if you eat it with cottage cheese.
Yeah, right. Like 4-year-old, she doesn't know. So if I walked into her nursery school and saw the Doritos Center for Nutrition, as a parent, I would be frustrated because they said, so that's one of my concerns. I don't know what you think, is that dental students don't have the dental mind development to really process these decisions the way we do. What do you think about that?
Because you're, as a dental student, you're absorbing everything. One thing I've joked with people about is when I graduated, I knew a little bit about a lot of different things. I knew a little bit about everything, and you kind of start filtering that down as you graduate and you start really kind of focusing on the things you see more. But as a dental student, you're just absorbing everything and you're processing it, but it's you're not at a point where you can really differentiate, what's valuable information and what's not.
Very, very true. So you've been part of the Dental Nachos Facebook group. Tell us, has Dental Nachos helped you feel less alone, laughed? What's it been like to be a member of this Facebook group for you? And when did you join? A few years ago?
I actually joined, about 2 years ago.
Okay, gotcha.
So it's helped to see, really, connect with people. It's a great forum. Just as far as connecting with other professionals, and it's also been a good, beyond just connecting with other professionals, a good connection point. I've even seen Dentist Job Connect. That is a great, that's a great.
I always tell
source.
people, dentists go, I want to do these great veneers. We need a job first, right?
Yeah, start with a job.
Sometimes and I think that dental school should at least talk about the concept of looking for jobs early, not applying, but what do good jobs look like? What do problematic jobs look like? I appreciate that. And you've added a lot of fun content. I don't know, I hope this comes across. I want dentists to take themselves less seriously
Mm-hmm.
and have a little bit more fun. And hopefully Dental Nachos does that.
Yeah. And I mean, that's what I try to bring into my practice is
Yeah.
I try to make it fun, you know, and I think that just comes with experience. I feel like in the time I've practiced, I've gotten to know myself, and that's helped me be better at communicating with my patients and really just connecting with them. And yes, it is important for you to really just have a sense of humor about yourself. You know, go into your day knowing, even when you know you have that difficult patient that you're going to have to deal with, you know, prepare yourself for it mentally, but also at the same time, going with a listening mindset, you know, hearing them out, you know, don't do all the talking, let them talk, you know, let them bounce it off of you. Cause a lot of times they just want to be heard. But yeah, I mean, like you said, it's all about really just not taking yourself too seriously, not being so narrow visioned and being flexible with your day.
As we wrap up, I appreciate you sharing, but I always like to deliver value. And I tell people, if you want to be a dentist, don't ask a 62-year-old orthodontist who hasn't picked up a drill, is dentistry good? Because that's like asking your grandparents about the newest social media. It doesn't mean they're not great to talk to as people, but they're kind of out of the game. Okay. I have a 4 and an 8-year-old, and I'm out of the infant game to some degree. If some parent called me up right now, text me, said, Paul, how do I get my infant to sleep? I text back, I don't know, I forgot. Right?
Oh, bro, I'm out of the Gen Z game. I got my oldest 2 kids are 16 and 17, and they use language I don't know what they're talking about.
What would you tell a new dentist 1 to 3 years out of school? What should they invest in? What should they pay attention to? Help them for a minute? We talk a lot about the dental student, talk a lot about the practice owner, but how about these people who are new in their career? What would you tell them to do?
If it depends on what your focus is and what you want to achieve, because every dentist is going to have a unique perspective and a unique goal. You know, some people, they want to be business owners. Some of them, you know, just want to be clinically minded. The biggest thing I think is, first off, figure out who you are, figure out what your vision and your goals are, because people can give you all kinds of advice, and until you know what your vision is and what you want to do, you know, what they say is not, you're not able to differentiate the value of what they're providing you. So really just, I would say, first off, if you are looking private practice, learn business structure, learn about overhead management, learn how to, you know, recruit patients, how to, you know, communicate effectively. Communication is a really big thing.
I was going to say that. So communication and connecting with people helps you inside and outside of your operatory, helping people, motivating them to move forward with something. And motivating them to move forward could be motivating your dental assistant to get the operatory ready on time.
Yes.
It can be motivating your front desk team to feel comfortable having a conversation about money. So connection and communication, it's about you saying to somebody, investing $30,000 in your teeth, it's a lot of money, and you're going to be glad that you did it. Because when you're done with this, you'll be able to chew and smile with confidence. Let me show you a video someone did. So I really appreciate it. Anything else you want to share with the Nacho audience before we wrap up?
I don't really have anything else to share other than, you know, as a professional or as a dental assistant, you know, whatever your role is, if you're a dental school student still, you know, really just focus on discovering who you are. Don't just worry about the curriculum, that final exam, that practical, that board exam. Yeah, I mean, that consumes your mind. I remember those days. It gets better, trust me. But really focus on discovering who you are, what you're passionate about, and what you want to be. You know?
I like that. And also, one bonus question. So you've been on Dental Nachos for a couple of years, but you got here 40 minutes ago. So is this kind of what you expected from me in person from the Nacho group? Am I similar? Am I different? What do you think?
You're more awesome in person.
Oh, thanks.
No, totally.
See, you're more awesome in person. You're awesome, Josh. Thanks so much. See you guys later.